Hello and welcome. NAFDAC and Your Health is back as usual to give you information on NAFDAC, that agency that is saddled with the responsibility of safeguarding the health of the nation, and to also educate you on how to sustain your well-being by patronizing only wholesome food products, drugs, cosmetics, and medical equipment. I am your host, Amanda Ugo. Today on NAFDAC and Your Health, we'll begin with the press conference where the Director-General of NAFDAC, Professor Mojisola Adeyeye, gave account of how the Global Fund Resilience and Sustainable System for Health was utilized to strengthen NAFDAC's regulatory system and the impactful regulatory methods the fund were used for. Then, on the second segment, we'll move on to take highlights of the destruction of fake, falsified, and substandard regulated products, which recently took place in Kuje Area Council at the Federal Capital Territory. Safeguarding the health of Nigeria is a task which NAFDAC, particularly under the leadership of Professor Mojisola Adeyeye, has resolutely committed all energy that can be mustered and all resources that can be harnessed to. This is to ensure that under whatever circumstance, the agency does not fail in delivering on its mandate. For this reason, the agency goes all out to seek all necessary partnership and support both locally and internationally. One of the supporters who have made the agency's most remarkable achievements in recent times possible is the Global Fund Resilience and Sustainable System for Health, GF-RSSH, through a grant given to the agency via the National Agency for the Control of AIDS, NACA. In her characteristic manner of being accountable to the latter, the Director-General of NAFDAC, Professor Mojisola Adeyeye, in a press conference in the agency's Abuja office recently, explained in details how the $2.3 million grant gotten from the Global Fund Resilience and Sustainable System for Health have been judiciously expended to strengthen the agency's regulatory system and make a lasting positive impact on the well-being of the Nigerian public.
The National Agency for Food and Drug Administration and Control is mandated to safeguard public health by ensuring that food and drug products are made available to the public and these products are safe, effective, and of good quality. NAFDAC is proud to announce the significant strides it has made in enhancing the safety and quality of pharmaceutical products in Nigeria. This has been through the implementation of pharmaceutical traceability, where you actually follow the medicine where it goes, through pharmacovigilance, that is safety monitoring, through post-marketing on the field, checking for substandard falsified medicines, and all other system strengthening interventions. This implementation of pharmaceutical traceability, pharmacovigilance, post-marketing, survey, and other system strengthening intervention has been made possible through Global Fund, Resillient, and Sustainable Systems for Health grants. It is called GF-RSSH. And this is done with the National Agency for the Control of AIDS, which is NACA, as the principal recipient, meaning the money went to NACA and then from NACA the money is distributed around. The Global Fund is an international financing institution dedicated to combat HIV/AIDS, tuberculosis, and malaria. It provides support to countries in their efforts to address these global health challenges and to strengthen health systems. For more information, you can check their website. The National Agency for Control of AIDS, NACA, is Nigeria's main organization for the control of HIV/AIDS and is responsible for coordinating the response and provides strategic guidance for national response.
The NAFDAC DG enumerated some of the landmark achievements of the agency which have been made possible by the GF-RSSH grant.
Under the GF-RSSH grant, several lines were implemented by NAFDAC during grant cycle 6, and this total about 2 million. The first one is about strengthening NAFDAC's role and capacity in pharmacovigilance for a sum of about $36,000 or about $37,000. Over the years, NAFDAC has invested in the capacity building of staff in pharmacovigilance. However, in ensuring sustained delivery of its mandate, the skills and competence of its staff require continuous capacity strengthening and advancement. That is where Global Fund comes in. The budget line BL33 was used to support the capacity strengthening of pharmacovigilance officers in recent developments and advances in pharmacovigilance and advanced drug reaction reporting in Nigeria. And this is in line with the newly revised National Pharmacovigilance Policy of 2020. NAFDAC has successfully built the capacity of 76 staff members across 36 plus 1 states on pharmacovigilance of AIDS, tuberculosis, and malaria. Another portion of the grants is called BL106 line, supported NAFDAC to acquire mobile app for ADR reporting or advanced drug reaction reporting. This is a smaller amount, but nevertheless, it has done the job. The implementation of a mobile app has streamlined the reporting and monitoring of adverse drug reaction and improving the overall responsiveness of the healthcare system. To ensure that the medicinal product is the right medicine which the label carries, another Global Fund line supported 3 state offices with 3 field devices. That device is called TrueScan, and this is for rapid on-the-spot check for product quality. That cost about $184,000. NAFDAC state offices have been further equipped with some devices for rapid screening of product quality and for substandard products detection. Alongside this is the funding for Yaba Drug Lab. Strengthening of our lab is extremely important for sustainability. The Yaba Drug Lab was supported to conduct comprehensive analysis of ATM and other disease programs, and this support was about $1 million, $944,000. And this was a huge contribution by Global Fund to NACA system strengthening. The purpose is to support and strengthen existing NAFDAC laboratories to sustain their ISO 17025 accreditation and to get WHO pre-qualification. This initiative has enhanced NAFDAC's laboratory capabilities using comprehensive analysis of many medicinal products. Significant procurement included liquid chromatography instruments, dissolution apparatus, disintegration apparatus, FTIR, UV spectrophotometer, and so on. It is good to share success story that the Central Drug Control Lab Yaba has attained World Health Organization pre-qualification, partly because of the Global Fund support. The implication of this is that many more medicines will be tested for quality in our lab with confidence, and this will ensure access to quality medicines by our citizens. Another very impactful support was that of phased implementation of track and trace or traceability of health products. That support was in the amount of $1.5 $1.13 million. This budget line has been instrumental in rolling out a phased implementation of traceability for health products in Nigeria. This support from Global Fund has had a profound impact on NAFDAC's goals of ensuring the availability of safe and high-quality ATM health products to Nigerians.
According to the NAFDAC DG, through these achievements made possible by the grant, NAFDAC can now productively identify and mitigate potential risks associated with pharmaceutical products, thereby safeguarding public health and contribute to the overall trust and confidence in the healthcare sector. She also expressed NAFDAC's commitment to sustaining the successes so far achieved.
Looking ahead, NAFDAC is committed to ensuring the sustainability of these efforts. We plan to continue building on the progress made through the Global Fund RSSH grant by enhancing regulatory frameworks. NAFDAC will work on strengthening the frameworks to ensure long-term sustainability by increasing capacity building or continuous training, by public awareness, which we do almost every week through NAFDAC and Your Health and other routes. And partnerships, through partnerships. NAFDAC will continue to collaborate with all our partners, including Global Fund, World Health Organization in Nigeria, USAID, Bill and Melinda Gates Foundation, and UNICEF, in order to advance all these initiatives. We plan to enhance the capability of the Agulu and Kaduna NAFDAC laboratories that routinely use risk-based approach for ascertaining the quality of medicinal products. We look forward for support from Global Fund to strengthen these laboratories toward WHO pre-qualification. We acknowledge our other partners, USAID, WHO, Bill Melinda Gates Foundation, and UNICEF. These partners have extended their outreach to us, and NAFDAC is presenting a heartfelt gratitude for their invaluable contributions to these initiatives. USAID has donated scanners also for training, as well as in-country serialization. BMGF, Bill Melinda Gates Foundation, has supported us with scanners and monitoring. UNICEF has donated a lot of scanners to support traceability. More of these announcements for these other partners will be made available in another press forum.
In his reaction, the Director-General of NACA, Dr. Gambo Aliyu, expressed his excitement on the achievements NAFDAC through the GF-RSSH grant, as reeled out by the DG.
I was even more excited when I sat down and I listened to the DG narrating the successes achieved with just $2 million. It shows a lot. And what I was thinking is, well, as part of what we look out for when we provide resources and when we go to the port, is value for money. So this is true value for money. And for some of us that will be thinking, what is the connection between National Agency for the Control of AIDS and grant funds that basically support something other than the control of HIV? NACA is the coordinating entity, national coordinating entity of the national response to HIV. But our work does not stop with coordinating national response to HIV. We are responsible for mobilizing resources, both external and internal. One, to support the national response, and two, to strengthen the system. So this is part of what we do. We mobilize resources, we receive grants, and we channel those grants to national for federal and state institutions to strengthen them. And I'm happy over the last 15 years, we've done a lot in system strengthening. It is because of the investment. We want to make sure that the systems, or our systems in the country, are strengthened to such a level where we achieve what we call emergency epidemic preparedness in terms of resources. When there is any epidemic in the future, not COVID-19, not Ebola, because we have responded very well to Ebola, we have responded very well to COVID-19. We have responded remarkably well to HIV. And we intend to have a system in country that will be more than ready to respond to any emergency epidemic that may probably show its heads in the future.
Dr. Gambo Aliyu assured that with the impressive achievements made by NAFDAC, NACA will strive to ensure that NAFDAC gets more funds from the GF-RSSH. However, the coordinator of the GF-RSSH in Nigeria said the impressive utilization of the grant qualifies NAFDAC for more in the next cycle.
If you look at the DG NAFDAC statement, this grant cycle is 2021 implementation period to 2023. It's a 3-year grant cycle. And for the successful utilization of the allocated resources, I'm happy to inform you again that Nigeria as a country is privileged to also receive additional resources because we've used the one that was allocated for the period 2021 to 2023 judiciously. We now receive another more funding in form of grant, $933 million, which we will be spending from January 2024 to December 2026, cut across HIV, tuberculosis, malaria, and resilient system strengthening for health for the period of 3 years again. That is to show that we've done so well in this period and then we deserve another grant. And just to add to what DG NAFDAC said, the grants that I just mentioned now for 2024 to 2026 will also be providing additional strengthening resources to strengthen the capacity of NAFDAC moving forward, because Nigeria can't if we must eliminate tuberculosis, HIV, and eradicate malaria in our country.
NAFDAC and Your Health continues after the short break. Welcome back. You are still watching NAFDAC and Your Health. The war against fake, substandard, and falsified regulated products is one that NAFDAC takes very seriously. This is because to relax on this war means to compromise and give room for the jeopardy of the entire efforts of the agency. This is why the agency's Directorate of Investigation and Enforcement is always on its toes to clamp down on agents of the heinous act. Even after the seizure of fake, falsified, and substandard regulated products, NAFDAC sees to it that thorough mop-up exercises are carried out to completely rid the market of such products, after which the products are destroyed to ensure that they do not find their ways back to the market. One of such destruction exercises recently took place in Kuje Area Council at the Federal Capital Territory, Abuja, under the supervision of NAFDAC DG, Professor Mojisola Adeyeye, who was represented by the Director, Investigation and Enforcement Directorate of the agency, Mr. Francis Ononiwu.
The destruction exercise today is for seized products and products handed over by compliant government and private agencies. There are products that are meant that have expired, that are also violative in the sense of being unwholesome. Also, there are products that are not registered. So most of them seized from people who are criminally minded, who are carrying out illegal activities of distributing these unwholesome and fake and falsified products. So what we are doing today is a destruction exercise for FCT area. The destruction also includes Nasarawa State and FCT. Those are the products that are being destroyed here.
According to the Director of Investigation and Enforcement, the destroyed goods were worth 6 million naira and that they are all NAFDAC regulated products. He also allayed the fear of the destruction posing health and environmental risks.
NAFDAC is a government agency, and also the Federal Ministry of Health and the State Ministry of Environment, and we work collaboratively. So for us to have take over and to destroy this product in this means, it must have been approved by the Ministry of Environment. So the destruction, the method being undertaken today is not hazardous, it's not harmful. That is why the environment allowed us and permitted us that we should use this method to destroy it.
Also present to witness the destruction exercise were the representatives of the Standard Organization of Nigeria and the Association of Community Pharmacists of Nigeria.
SON and NAFDAC are sister agencies. So when it comes to the area of regulation, SON and NAFDAC actively collaborate. So that's why we're invited to witness the destruction of these fake and substandard products. If you are there, we know SON is engaged in serious compliance activity, and among it is a seizure. In fact, if you are there, maybe you saw it on the news, we have just destroyed tires. You know, tire is a large endangered product, and SON has a very serious interest in that regard. We've gone into very serious compliance action, which is called enforcement. Seizure has been made. In fact, about on the 29th of September, to be precise, we destroyed tires, and these are some of the things we do when it becomes necessary.
Our role here is, because we partner with NAFDAC, the drugs that are in circulation within the country are mostly obtained from the community pharmacists. And we are here to present all the expired drugs that are domiciled within the community pharmacists. We brought them together and have brought it to NAFDAC for this destruction today, so that it will not find its way back into the circulation. That is why we are here. Within the community, we are the one that's render pharmacy services, pharmacy care to the community, to members of the community. And in the course of that, some of the drugs that are not consumed before the expiration date, we gather them together, put them together, and surrender it willingly to NAFDAC for destruction, so that it will not be found in circulation.
That has been our package on this edition of the program. Join us again, same time, same station next week for another edition. If you have questions, reports, or any information that will help NAFDAC further safeguard the health of the nation, please contact us.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Remember, it is illegal to import, produce, distribute, market, or sell unwholesome food products, drugs, cosmetics, and medical equipment. Join us to expose the perpetrators of this crime and expose their illicit acts. Till we meet again next week, stay safe.